One of the joys of working on this event, the Impact Forum, is the opportunity to work with leading edge organizations, as well as leading edge thinkers that push us into undiscovered places. And certainly one of those companies is Sharecare, developed by Dr. Mehmet Oz and Jeff Arnold. Sharecare is a health and wellness engagement platform that provides people like us with personalized resources to help ourselves live our healthiest lives. So one of the bright minds at Sharecare is President Dawn Whaley. She's a masterful collaborator and has the ability to take fascinating ideas, turn them into actionable business models. Dawn is focused on the development of corporate strategy, co-management of operational execution, marketing, and business development for the company. Along with Jeff Arnold, she was also one of the early pioneers of WebMD. A good friend and someone we enjoy working with very much, I would like to welcome back to the Impact Forum and to Lake Nona, Dawn Whaley.
Wow, that was the nicest introduction I've ever gotten. Thank you, Gloria. I really appreciate it. And thanks to Thad and Gloria for letting us be part of this fascinating and very necessary conversation. As Gloria just outlined, I'm here to introduce Jeff Arnold. We've worked together for the last 16 years, going back to the early WebMD days. And since then have started several different companies with our partner, Justin Ferrero, who had better be in this audience. I'm not seeing him right now, but actually he's waving to me from the back of the stage. Good job. And so in the latest venture is Sharecare. And I thought to properly introduce Jeff, instead of running through all of his amazing accomplishments, which there's a lot of, I would actually tell a quick story. So I'm going to go back just a few years when I was like 15, just kidding, into the late 90s. And at that time, WebMD was literally acquiring a company a day and going from no revenue to $1 billion in revenue in about 12 months. And we were the agency. I worked for an agency that was the agency of record, and I was lead on the account. And I had just gotten off a red eye coming back from Silicon Valley, and my phone rang, and I was trying to hurriedly get home to see my new baby. And I was asked to come into the WebMD offices for a brainstorming session. And I kind of pushed back, and they're like, no, this is really going to be big. You need to come in. So I said, all right, I'll come in. And got there, and the topic of the day was talking about Breast Cancer Awareness Month and everything we could do to create impact in that time period. Now, you have to know that this conversation is taking place on September 23rd, okay? So October's just a few weeks away, and I think this is just a conceptual brainstorm. I'm like, oh, this is so fun. We're just gonna show how creative we can think. We're not gonna really do any of this, right? So in the spirit of that conversation, there was a big group in the offices. Jeff says, what we need to do, we need to give away free mammograms. There's so many people out there that don't have access and don't have the capability to get a mammogram. We need to do that. And we're all like, yes, we totally need to do that. And this is all the ways we could do it. I get in my car, I go home, and I'm thinking, yeah, that was so fun. Next year, we're gonna nail it for Breast Cancer Awareness Month. My phone rings at night, and they say, this is gonna be the standing call we're gonna have every night at 7 p.m. until October 1st to get this executed. So I said, all right. So we do the calls, and long story short, on October 31st, Jeff had partnered with Rupert Murdoch and News Corp, and we had created a PSA with Gillian Anderson of the X-Files and Marge Simpson of The Simpsons, which reached 100 million people over the 30 days. He had partnered with Tenet Healthcare, because in the PSA, the call to action was to go to the website and to see if you could qualify for getting a mammogram. We'd given away 22,000 free mammograms, and 5 women that were actually diagnosed with breast cancer, basically their lives were saved through that endeavor. It was there that I realized that I was working with somebody incredibly special, and that, you know, he could take a really big idea, make it actionable, and actually create impact. And so he's been, you know, stuck with me ever since. And so with that, I'll bring Jeff up on the stage.
Good afternoon. It's a pleasure to be here. Anybody who knows me or knows that any accomplishment that I've ever had was really Dawn giving me the credit. So, and that's the truth. But it's an honor to be here today to talk about the Engaged Patient as the New Drug, because we believe that movement has happened. It's not in the future, and we'll see more progress over the next 24 months than we've seen in the last 10 years. So when we think about that engaged patient, we spend a lot of time thinking about how do you create a profile on that person, whether that person's a patient, an employee, a consumer. And in that profile, how do you ground it in ultra-personalization and interoperability? And outside of healthcare, others have done that really well. So if you think of Amazon, for example, they've nailed your retail profile. They've gotten so good at predictive analytics, they're shipping dog food to fulfillment centers in your backyard before you've even ordered it yet. How do we start to get to that level of precision in healthcare? Once you establish that profile, how do we start to build stacks of services in the cloud that meet people at different places in their health journey? So whether it's a health risk assessment, clinical decision support, connected devices, online scheduling, telehealth, transparency tools, how do all those best-in-class services meet each other in the cloud to get to people at different places in their health journey? I think the third critical element is how do you build digital alliances with caregivers? And so I think in this empowered consumer movement that we're going through, you have to have a consumer lens. So as you build your products, you really have to think about the consumer first, but how important it is as you wear that lens to also foster and build bridges for consumers and providers to be able to interact and build that digital trust we think is going to be paramount in the future. And then lastly, how do you educate the consumer? So if you've got this ultra-personalization and all these great products and services, and you've got the healthcare, you've got caregivers brought into that strategy, how do you start to foster data-driven dialogues that are consistent in the exam room and the living room? And what you're seeing today, I think, with this empowered consumer is you're seeing a convergence of media, technology, and healthcare all kind of coming together and converging at the same time. And so it was an honor today to be able to moderate this panel because I've got three amazing panelists who are all about media, technology, and healthcare. Dr. Mehmet Oz, Dr. Sanjay Gupta, and Dr. Mark Hyman. And before I thought I'd bring them up, which I thought I'd do individually, I thought maybe I'd tell a little personal story about each of these guys. So for Dr. Oz, back in 2010, I had a little company called How Stuff Works, and I sold it to Discovery Channel. And Discovery had just created a partnership with Oprah Winfrey. And I get called, it's the first week, and they say, hey, you're the WebMD guy. Will you get on this conference call with a bunch of people with Dr. Oz to brainstorm about digital strategies? So I was sure. So I get on the call, and we're having this dialogue. And at the end, Dr. Oz says, really what I want to do is I want to inspire digital caregiving. How do you do that? And very profound statement back in 2010. And so, I said, let me think about that a little bit. That's a great question. He then says, what does How Stuff Works do? And I say, well, there's all these searches happening in Google, and we write content that performs really well in organic search. So if somebody types in hybrid cars, you would find how hybrid cars work and working on the psychographic, not the demographic. He says, yeah, well, how do you do that? And I was like, well, quality rises to the top. So hang up the phone. Never talked to Dr. Oz before. My cell phone rings an hour later, and he had cold called the CTO of Google, and he began to educate me on how an algorithm determines relevance in a nanosecond. so Dr. Oz, welcome. Great to see you. Thanks.
Do we get to defend ourselves?
Yes, of course. So next, Dr. Sanjay Gupta. So I'm like, this is amazing. Sanjay and Dawn and I and the team, we all live in Atlanta, Georgia. And so I get the pleasure to meet Sanjay. And Sanjay is really passionate about human potential and how do you optimize consumer-driven healthcare. So they had just built this belt line, which is kind of like the High Line in Atlanta. So I was like, Sanjay, let's go for a walk. We'll walk and talk and we'll brainstorm together all about human potential as we were getting to know each other. That has quickly escalated to now I'm getting texts from him saying, when are we going to hike Mount Kilimanjaro? so with Sanjay Gupta. Good to see you. Thanks. Yeah. And lastly, Dr. Mark Hyman is probably the world's expert in functional medicine and has just opened this great new clinic at Cleveland Clinic. And when I met Dr. Hyman, he was working on the Daniel Plan, which was a collaboration between Dr. Oz, Dr. Daniel Amen, and who's the?
Rick Warren.
Rick Warren. Yes, the biggest of all is they were working on this collaboration, basically bringing healthcare into churches. And what I've quickly learned from Mark, which I hope we'll talk today, about the power of relationships and the power of communities. And if you really want to sustain change to this empowered consumer, how important the relationship plays in that pivotal role. So with that, please, Mr. Hyman. Good to see you. Thanks. Okay. A little different when you're not asking the questions.
I'm looking for the prompter. It's got to be out there somewhere. There it is.
So today, we all get to work on these engaged patient solutions a lot, and it's a real passion that all of us have. And today we announced a partnership with Lake Nona and Univision and several other partners, where our goal is how could we build the largest crowdsource adaptive trial ever using a frictionless technology. So we found this great artificial intelligence expert named Eric Feingold, who's in the front row here. And Eric started to educate us on the power of voice and how you could basically look at a phone call and you could look at a fractal pattern. And that fractal pattern could tell you about your mindset. And the idea the simple idea is could self-awareness about your actual stress, not your perceived stress, tied to a relationship such as your spouse, your kids, or your coworkers, change behavior. And so we have launched this new technology today in partnership with our friends at Lake Nona. And Dr. Sanjay Gupta has been kind enough to be the chief investigator of this trial. And with his passion around optimization, I thought maybe we would just start off with having you tell us a little about human potential.
Yeah. Well, thank you very much for that. And it's an honor to be here. I've been interested in this sort of topic for quite some time. And, it's interesting, and by the way, sitting will kill you. I don't know, did you know that, Oz?
11% mortality.
Yeah.
A lot of pressure. Right.
You should actually stand. He's not kidding. It's true. Just for his answer. Then we'll sit again.
Yeah, right. It's a long answer.
Okay.
Oh, that.
There you go.
Right. Good to get a standing ovation.
Now we got a standing ovation. That's right.
Yeah, right, yes. But I'll tell you, the idea of being a doc, like we all are, who's transmitting messages to large groups of users, consumers, potential patients, is a really interesting thing. And part of it just starts, I think, with simple semantics. I've seen a lot of words tossed around today: healthcare, medical care, care overall. What is it that we're trying to do, and how does it make people feel inspired to actually do it? And I think that's just a really important fundamental point. We think about this in such a didactic way sometimes, so that the engaged consumer has to be engaged for the right reasons, and reasons that are going to make them feel good. And when it comes to preventive care in particular, I think it's really important, because preventive care, you're asking people to do things that may not necessarily make them feel good, and they may not necessarily see the results of those things, at least not at the time. So these are important fundamental points that I think direct a lot of the thinking when it comes to some of the things that Jeff's talking about. I got really interested in I'm a neuroscientist. That's my background. That's my day job still. The brain is more important than the heart, by the way. Just more on that later. But the idea between the idea of neuroscience and fill in the blank, whether it's well-being, healthcare, making people feel good, that inflection point has just been a fascinating area for me for a long time. What do we know about how the mind works, the brain works, how behaviors can be predicted, and translate those things into making people feel good, and as a result, be healthier. And voice, as Jeff mentioned, ended up being that inflection point. It was a way of giving people feedback on their mindset right away, that they could actually see how they were doing and perhaps create changes on the fly. It was consistent, it was reliable, and it was something that they didn't otherwise have. We know, and Eric Feingold, who Jeff mentioned, has done a lot of research in this area, but one of the things that he, along with others, was able to define was that we can measure mindset. This is an objective thing that can be done. It's been done for a long time through MRI scanning, functional MRI scanning more recently, it can be done. And the idea that voice can also be an objective measurement of mindset, something that we're using all the time on the phone, talking to people, and getting feedback on what we're really doing, how we're really feeling, what our mindset really is so important. If we, Jeff has called it living in the green. You get a green sort of feedback on this when you're in a good mindset, red if you're not. But the idea that you want to be living in the green more regularly is a very, very easy to digest message. And if you are living in the green, I believe all the other things follow. You are more likely to engage in good health behaviors. You're more likely to work harder at your exercise routine. You're more likely to be productive at work. You're more likely to have good relationships with your family and friends. Everybody wants that. It feels good and it feels relevant right now. So the voice as an inflection point to measure mindset that gives you those healthy behaviors based on the way the brain works is something I've become really, really interested in. And I think that's what we're talking about here today.
Yep.
Now let him say. Sanjay, this is what neurosurgeons do. They operate very slowly. They stand all day long. They're camo drivers.
We like to take our time, Practice makes perfect, right?
So, Dr. Oz,
You don't want a fast neurosurgeon.
Yeah. Oh, yeah, right.
Just a fast heart surgeon, because the brain's more important than that.
Dr. Oz, you have taught me a lot about how to talk to consumers and how to do data-driven dialogue and how to be relevant and how to meet them where they're at. And this search that you've been on for frictionless ways to be in everybody's life every day at moments that matter. Can you maybe talk a little bit about that?
So let me get to the heart of the matter, not the brain of the matter. It's remarkable the poets speak of hearts all the time. Cold hearts, hard hearts, warm-blooded. But the brain doesn't come up.
That was before we had science, though. And we've been able to...
So the fundamental challenge I think we all face, all of us in this room, is how do you get people to move from the pre-contemplative place in their life, where they're not even thinking about changing, to the contemplative space. And I bring this up because most of us think of psychology or psychiatry as, Sigmund Freud, it's your mother's fault, it basically a study of why you're messed up. But we're all in the change business. And in the change business, you're not really concerned about why you're messed up, you're concerned about what you're going to do going forward. And so to be able to mobilize 80%, 4/5 of the population into a space where they're thinking about it becomes the major opportunity. So Sanjay mentioned voice. The reason I'm sort of intrigued by apps that tell me things I didn't know about myself without me doing anything is it's the perfect antidote to ignoring reality. So many times, people bring me a cool little idea, since we're on phone apps. A phone app, if you write down everything you eat, it'll tell you how much you ate. Well, that's not a huge favor to me, right? It's a lot of effort for some gain, but maybe not as much as people may think. But people still do it, actually, remarkably frequently. Exercise is a little better because I can put something around me or on me, or maybe I'm getting a very nice gift. Thank you for the folks who are giving it to us. So it tells me stuff about myself that I don't have to keep track of, and I like that. But at the end of the day, I look at those devices and I think to myself, well, there'll be many ways of getting that information. The question really is, how do we craft the data in a way that the predictive analytics can tell us what to do with it? So sometimes it's as simple, and Jeff has made this argument, and Eric has as well, that if you just give people the information about their mindset, they'll be able to adjust. Other times it'll be a bit more complex, but fundamentally you want to make it easy for people to do the right thing. And if you partner that basic insight, that if it's easy, they'll do it, and if it's hard, they won't, no matter how valuable it might be, with the other big insight, which is that people don't change based on what they know. They really don't. Yeah. And none of us do. Most of you don't either. The important things in your life, you do not change because of what you know. You change because of what you feel.
Yeah, I want to come back and talk to you about relationships and how that works and all of this. But I think Mark, I've learned a lot from you about the power of community and sustained change, and maybe talk a little bit about Fed Up and lead into the Daniel Plan and the results you're seeing. And then I would love even to get just kind of a macro view on functional medicine.
Yeah, well, that's a lot to cover in 3 minutes. I think the fundamental issue that I think has to be addressed is we have an acute care health system that is not going to solve the problem no matter how many bells and whistles and how many tweaks or how much optimization we get on doing the same thing better, because chronic disease is the juggernaut, We are at a physician shortage of 4.3 million docs around the world, 130,000 docs short here. We cannot cope with chronic disease using an optimization of our current healthcare system. We have to decentralize and democratize healthcare. And that's really the insight is, one, we have to learn how to optimize biology and function, which is through functional medicine. It's understanding biological networks. How do you actually get to the root of the problem and deal with the upstream issues that are driving disease? I mean, heart disease is not a statin deficiency. Diabetes is not a metformin deficiency. It's not better adherence to medication. It's really understanding the root causes. But that's only one part of it. The second part of it is, how do we get people to change behavior? So change biology, change behavior. Those are the two fundamental questions to create optimal health and reduce this juggernaut of chronic disease. And it's big, as you heard from our previous speaker. It's $47 trillion we're going to spend over the next 20 years. And the insight I had after going to Haiti, where I was with Sanjay, was through Paul Farmer, who cured TB and AIDS not through better application of drugs or surgery, but by understanding the power of each other. I call it the love diet. It's really the power of accompaniment to help people change their behavior. Peer support. It's like what Dr. Carmona was talking about earlier, how he went to the West Wing and had dinner and everybody was worried about what they ate next to him. And it's and just as infectious disease is contagious, so is chronic disease. And so is health contagious. As we learned from Chris Sakis' work, if you're 171% more likely to be overweight if your friends are overweight, and only 40% more likely to be overweight if your parents are overweight. So the social networks are really what drive health. And so I got to meet Rick Warren, who came to my office to lose weight. And I had this insight about how we need to sort of put people and communities at the center of healthcare and disrupt the whole healthcare system by doing that. And he said he was overweight, wanted to get healthy. And I said, why don't we create a healthy living curriculum through your small groups in your church? There wasn't a mega church, it was thousands of mini churches. And he's like, great, because I was baptizing my church last week, and after about the 800th one, I'm like, man, we're a fat church, and I'm fat, and we need to do something. So it was sort of like Jeff Arnold, you think of an idea, it gets done. He says, we build the jumbo jet while we're flying it. We launched this. We got Mehmet involved, Dr. Hyman, and we created the Daniel Plan, which was a healthy living curriculum delivered through small groups. And the groups weren't the delivery mechanism; they were actually part of the therapy. And the people who did it together lost twice as much weight. 15,000 people signed up the first week. They lost 250,000 pounds the first year. All sorts of health conditions went away. It was driven by the science of functional medicine to get people healthy, which is the science of optimization, resilience, creating health. Diseases go away as a side effect without treating them directly. But the power of change, the behavior change, was through people doing it together. And that's really, I think, the fundamental insight. How do we actually use the power of social networks, sort of Facebook for health, to get people to support each other, encourage each other to create those changes? And leveraging some of the technologies like what Sharecare is doing. He's got 87 million registered users, 40 million people have filled out real-age questionnaires. So we have data on people, we can aggregate them, we can use support systems, that all kinds of novel ways, either in person or online support, to get people to change behavior. Because we are not going to solve the problem by dealing with optimizing the current healthcare system. We need to do it, it's necessary. We need to improve health IT, improve all this data. We need to optimize physician-patient interactions, better adherence to current therapies that work for acute disease. But for chronic illness, current therapies don't work as well as lifestyle interventions. And how do you get people to change behavior? You have to do it through, I call it, the power of love.
Yeah, and with all these kind of various data doors that are available to us as consumers, Sanjay, I get so excited, like when I hear you talk about like the tip of the spear and what's the truth. Like Sanjay and I had an opportunity to go to Apple with Don, and we had these exciting meetings with them, and we were talking about HealthKit, and Dr. Oz, we went one other time, and we were talking about HealthKit, but talk a little bit about like the truth and big data, and then how does that all come together in a very personal way to optimize somebody?
Yeah. It's interesting because self-awareness is a funny thing. I think we can be self-aware up to a certain point, but when we don't like the answers that are coming back, self-awareness starts to go off. So around the edges, self-awareness doesn't work really well. You can ask your family and friends to give you feedback sometimes. That may not work as well either if you're brave, right? You can have secondary gain issues there as well. So the idea that there should be an honest broker in this thing, something that's really giving you feedback on yourself, that's the truth. That's the honest truth. You may not want to hear it always, but it is the truth. I thought was so important. Doctors, healthcare teams can serve that role to a certain extent, but the frequency may not be there. You may not go seek out your doctor. This particular voice technology, because we're using our phones all the time, it's passive, it's frictionless in that regard, gives you feedback that is the truth on how you're doing at any given time in terms of your mindset. And it's really specific. It tells you, again, through color coding, but also really specific adjectives to give you an idea of where you are before you might even recognize it. And I think that truth part of it ends up being so important. Without the truth, it's very hard for you to have any of the other things downstream follow. But also, I think mindset in and of itself becomes the tip of the spear. If your mindset is optimized, then all the other things become optimized. People have been asking me for years in various roles, how do we help people reach their full human potential? And it's interesting because it's a question that can be interpreted in lots of different ways. Do you mean your potential with respect to you? Do you mean your potential with respect to the human race? What does that really mean? How do you become the best you that you can possibly become? And the idea that if you're in the right mindset, again, all the other things will more likely follow. You'll be better at a lot of other things that you're trying to do in your life, including healthy behaviors. So the mindset part became really critical, and the idea of what to do with that data became really critical as well. Oz mentioned this idea that you can give certain knowledge, you can intervene in certain ways when people when they're self-aware, when they're seeking out care. But how do you give interventions at a time when maybe they don't even know that they need it yet? I find that really fascinating. If you are, let's just take an example. Let's say you, on your calendar, you had a run scheduled at 4 o'clock on a Tuesday afternoon, and yet we know, based on looking at your phone, that you're not moving, you're still in your office, and we also know that it's a nice sunny day outside, so the weather's not an excuse as to why you're not running. So what is it? We know that you should be running, you know that you want to run. The result of not running is probably going to start putting you in the red. It's going to start altering your mindset. What makes you run? Why do you run? Is it your family? Is it because you want to be around longer for your family? Perhaps a picture streams to your phone of family members that inspire you. It's different than content, something that we all do. We provide content. We can tell you over and over again why it's advantageous to run, and likely you already know all that stuff, or at least a lot of it. Right. We can make that better, but starting to provide those interventions in ways that are surprising, I think is all relies on having the truth as a starting point.
And I think the phone is such a powerful healing device, because what you just described is available today. Your phone can wake up and say, Sanjay's at Lake Nona. I've looked at your calendar and your first appointment's not till 10 o'clock. I've gone into your Runkeeper account and I've mapped a 3-mile run for you. When you start to run, I know what music you like to run to, and I'm going to play it for you. And when you finish, I'm going to give you a 2-day micropayment on your real age and let your family know it's accomplished. Bam, very seamless. And there's a lot of talk about everybody wants to Uberize everything right now, and we all love Uber. And you start to think about, well, how do you Uberize healthcare and that inherent trust that's still there with the provider? So if you can build connectivity between a person, right, a patient, an employee, a consumer, and a provider, and then you as a doctor have at your disposal an array of products and services in the cloud that you can be very prescriptive with. Do you see a time as a cardiologist, as a heart surgeon, where you're going to be prescribing apps to patients?
Oh, for sure. I think it's literally a year or two from here. It's just really a matter of building a back end that can harvest enough information. They don't feel like you're doing little one-offs each time. So let's talk about this issue of hospital discharge. I think it's an example of how you can put a hook into the wall of medicine as you scale that cliff. So folks go home traditionally, and I'm a heart surgeon, so I'll send you home with, let's say, some heart failure medications. And people fall off the truck. And we know that, for example, a major predictor of mortality for the most expensive DRG, which is heart failure, is how long it takes us to give you a diuretic, a water pill, after you get admitted. I mean, it's a pretty simple thing to do. Yeah. But the question you should be asking yourself, and it should respect the fact if you never had heart failure, it's been better. But if you have heart failure for whatever reason, there's things we can do to actually predict that you're having the problem even before you come to us. So follow the analogy a little bit. You went home, you had kielbasa. I like kielbasa, right? But the kielbasa, of course, retains salt, And so before you know it, you're a little bit heavy, and I can actually now begin to tell that you're heavier than you're supposed to be. So I can begin to intervene before you have to get readmitted, which automatically saves money, which of course allows me to charge, let's say, $500 for an app, because it's a meaningful medical intervention at the time of your discharge. But then take that one step forward. The time warp that currently represents medicine, and we've all said it in our different ways today, is that when I give advice to you on heart failure, I'm basing it on clinical trials done 10 years ago, published 5 years ago, very expensive, but interestingly, usually only sampling 1% on average of people who could have been in the trial. So again, 10,000 people could have been in the trial, only 1,000 or maybe even 100 get into the trial, finally to complete it. And then at the end of that, I publish it. It takes a while. And then I remember that, hopefully, from a couple of years ago, and I apply it. Change the paradigm to, there's 10,000 people just like you, Mr. Arnold, who had kielbasa today, who have your ejection fraction, your heart issues, and their weight went up like this. And we know that if we can give you XYZ treatment, it can meaningfully change your chance of getting readmitted to the hospital. Now, the beauty of that, of course, is then you sort of suck the air out of the room, because now that's where the recommendations will lie. The best advice to a patient is not based on historically relevant patient population, because there's no such thing really. It's based on people right now living that out. And I like the idea, the thought of that becoming part of our future. So some of these things we've been talking about, the voice app that Sanjay mentioned, it's not just about knowing if you're stressed or not. It's about telling us subtle things about what stress does in your body. The fact that it drops your blood sugar. The fact that you have cravings when you're in a certain place in your stress pattern. So think about that. Now I can tell you that if you want that kielbasa, and I can tell you're craving something, so you might resort to a kielbasa, that's when I start showing the pictures of your family, because to an earlier point, you don't change based on what you know. You know it's bad for you, obviously. It's what's going to motivate you not to make that action happen when you have a craving. So it stops becoming intrusive to your existence. Because much right now being bothered by a run keeper, you may think, I don't want to get bothered by a run keeper at 7 in the morning to go running. If I wanted to run, I would have run. But knowing that you actually wanted to do it and having the clues to tell when to tell that message to you makes it inspirational, not irritating.
It's really interesting too when you think about all the data that comes off the phone, right? So the weather, the accelerometer. You can look at text the way you can look at voice and look at verbs. And if I say the word hug to you, you immediately get a mental image for that. And then you start to think about, again, relationships, and you think about photos, right? So we all have photos on our phone. Are those photos our support group? Probably so. You can start to find patterns, and facial recognition is getting so good we can all get picked out of a crowd by Facebook, with 97% accuracy. Sanjay, when are we gonna detect disease through photos? How far away are we from that?
I think we're there. By the way, for the people who are writing about this, the headline is "Heart Surgeon Who Likes Kielbasa."
with some peppers, the sauerkraut, mustard, no ketchup. Ketchup's not good.
Ketchup's not good. I think we're pretty good at doing a lot of this now. I started looking at some of the deep facial analytics, and I'm sure people in the room who know more about this than me, but it's quite remarkable. Even if you ask somebody to wear the same clothes, several days in a row, give the same smile that they think they're giving the same exact smile every single day, what facial analytics can do is pretty remarkable. First, in terms of mindset, how many creases do you have around the eye muscles here? How much do you have around your orbicularis? How deep are those creases? All those sorts of things actually can be translated again into objective measurements of mindset. But then, simple things like how chapped are your lips? How dehydrated is your skin? You could start to get a fair amount of data, as you talk about a lot of the stuff on your show all the time, but just even looking inside people's eyes, being able to tell if they're anemic or something like that, if their heart medications are working, are they hypotensive, are they getting enough blood flow, all that. It's available now, I think, to your point again, Jeff. So it's not in the future.
Yep, and self-care being available now. Mark, what's your kind of 101 on self-care and functional medicine and the role that the empowered patient accessing it through digital health can play?
Well, I hinted at it a little bit earlier, but I think the fundamental sort of boogeyman in the room is that we don't have the capacity to care for the chronic disease burden. So we have to decentralize the care and create self-care solutions for patients that allow them to do this for themselves, giving them the tools, the information, and the structure to actually change their behavior. So you have to have the right content. I call it the 4 C's of healthcare transformation. You have to have the right content, which is how do you change biology? And I believe that's understanding the complex biological systems that are now sort of replacing our current diagnostic model. which is, I think, antiquated. So we have a 20th century diagnostic model, but we now understand complex systems biology. So how does your microbiome affect your metabolism, right? How does your mitochondria functioning based on your diet, for example, which affects your energy and performance. So these are things that are really sort of not really in the future. They're based on the sort of paradigm of functional medicine. So that's the content that drives changing biology and optimizing health. The second is the connections. How do we use the connections that exist either in real time in our sort of small community or online that allow us to change behavior? So we know that peer support is more powerful than anything else. You take a group of people who are mentally handicapped and teach them about how to improve their diabetes and work together to do it. They do better than any healthcare provider does. So the third C is community, which is how do you change the defaults in the environment that help people make the right decisions automatically. So not having sodas in the cafeteria if you have a corporation, for example. And then the fourth C is connectivity. How do you bring all this together through quantified self and other technology to actually facilitate these kinds of changes? And I think that will allow for real healthcare transformation, but it's not going to be in the healthcare system. We think of healthcare as being in the walls of hospitals and clinics. It has to be where we live. Health happens where we live, where we eat, where we play, where we pray, where we are every day. That's where health happens. And once we understand that and can design health around that, then we'll change everything.
Let me just add something. I think, and you write a lot about ultra wellness, which I think maybe is the term around human potential, human optimization. But this idea that you can ultra personalize optimization, I think is really interesting. We give advice all the time to walk 10,000 steps, to not eat certain types of foods and all that. And that's good advice, I think, generally speaking, from a shotgun sort of approach. But I may know for someone like Mehmet, for example, that if he runs 3 miles in the morning, he's going to have a pretty green day. If he runs 3.5 miles, actually not as good. He drops off. And that may be surprising, but I think the mantra has been more is better. Just eat, don't ever cheat on your diet, always run or exercise as much as you possibly can. And we now know from studies and many other large sort of segments of the population, that's not necessarily true. But I don't know what's perfect for Mehmet. I don't know how to get him living in the green most of the time unless I'm getting consistent, reliable feedback. So the ultra-personalization of optimization is something that can be done through this as well. Finding your sweet spot, my sweet spot, all of our sweet spots, I think is really, that ends up engaging people at a very high level as well.
Yeah. I'm going to ask you this question, but I really gives me a lot of hope is we're seeing this convergence of media, technology, and healthcare. They're all coming together. So you have these amazing communicators on stage here that can talk to the public about health issues in an engaging way. You have these giant tech companies building things like the Apple Watch that have all these built-in sensors that are coming very soon. And then most surprisingly is you're seeing the giant healthcare organizations care about consumerism. I did a panel in New York yesterday, and my panelist was the CFO of HCA, and in the front row was the CEO and chairman of HCA. They represent 5% of all healthcare visits, 7 million ER visits, 20 million patients a year, sitting in consumerism panels, trying to understand how is this media, technology, and healthcare going to come together, to create engagement. What's the role that media plays?
So it's an interesting dilemma. Sanjay touched on this, but I think if I can draw the bigger picture. When we give advice, we necessarily have to base it on exaggerated hope that it applies to everybody. Because we know most of the time, even simple advice like eat your leafy green vegetables might not be the best advice for everybody, depending on what else is going on in your life. So I think about the world of information sharing in the following way. There's a funnel that brings everybody into the experience, no matter where they are, because we're all going to enter the experience differently. The reason I love tools that touch our lives every day is because you'll use those tools. When you speak about Uber, you use Uber a lot, so you know where it is on your phone. Half the apps on your phone, you don't even know where they are, right? So you have to actually be able to touch people in a meaningful way. So if you've got a great solution that's going to really save a life once a year, no one's going to know it's there unless that top funnel was large enough to pull everybody in. That's what we do. When you talk to a couple million people a day, everyone's sort of there at some point if they want to be there. So but that's not just going to come because I'm on Fox or Sanjay's on CNN or Mark's hosting a big church revival. It's going to happen also because
I wanted to call the book the Daniel Plan, the Jewish Doctor's Guide for Christian Wellness. But
so
they wouldn't go for that.
They wouldn't go for it. It was too long. It just didn't fit in the art. So, but you want, when HCA starts saying we want people who are touching our experience to be part of this funnel, or the Department of Defense, because the military is a very big opportunity here, and that has been such an important part of development because they're willing to make long-term investments, university centers, et cetera. When you start to bring in large groups like that want their people, the people they care about, to connect in a way that allows them to at least be exposed to the right experience, then you create an ecosystem where many of the solutions, and I've talked to people today even who have wonderful ideas, I've never heard of them. And if I've never heard of them, there's a pretty good chance a lot of people haven't heard of them. And so you begin to think, well, goodness, what a wonderful concept. How are people going to find out about this? Yeah. We have to curate that in a way that actually does not intrude in your life, but make sure you're there. So whether we give you bite-sized snacks initially and then make them into meals, and you're going to have, just to speak to the money of this, they're going to have to be paywalls around some of these opportunities, or no one's going to pay for them. But there are, I do believe, many well thought through ways of how this could happen. But it's not going to look, media anyway, the way it looks today. It's not a sustainable model because it doesn't digitize well at all. Most media companies make 5% of the money or less on digital revenue, and most of the revenue you're getting is intrusive money. It's money spent to put a big banner ad in front of your face. I'm not a diabetic. I don't need that tip. Yeah. But if I am a diabetic, I want that tip expressed in many different ways, in any way I can get it, so we can begin to educate ourselves. I mean, take the Amazon experience. When you go shopping, they'll tell you things you didn't even know you wanted, but you probably do want, right? And they'll be there for you way before anybody else can, because they're actually predicting where you're going to be before you get there. It's the Wayne Gretzky model, right? They don't want to be where you are now. None of us want to be where we are now. We want to be where we're going to be in the future, so we can predict what you need there. And by doing that in smart ways, we'll be able to unlock a huge vault of opportunities by smart investigators and inventors, business people, making solutions that if people knew they existed, you'd use them. And that's where I think media plays its role. The currency that all of us use is still trust. The question becomes, how do you use that trust to connect people, to get their mind share enough that they'll know that you're not going to waste their time, and what you're offering up is meaningful, because trust comes in two forms. You know what you're talking about, and you'll do it with integrity. So if you can connect people in that way, they'll begin to take advantage of these services.
Right. You know where the magic happens too, I think, is Uber's taught us so much about convenience. And what I think is incredible about the Uber phenomenon is everybody remembers the first time they used it, and that little car coming around the corner, right?
And graded.
And the confidence that the car was going to show up. Yeah. But if I have a doctor's appointment tomorrow at 4 o'clock, the chances of me seeing my doctor aren't, I fear that's not going to happen. I don't fear that little car is going to pick me up, right? And so, as this connectivity starts to get established between providers and patients, I think a role media is going to play is that they're going to bring that trust back into the system.
Mm-hmm. And you do it with enough consistency that people begin to trust that it's there. And I can't, again, just from the folks I've spoken to today, if I'm just talking only you today, it'd be worth it. So many of these wonderful ideas. I mean, Patrick Swing has, pioneered cancer. But most of you, God forbid, if you were to get cancer, by the way, you all have cancer right now. You may not know it, but you do, right? But your immune system's killing them off, thankfully. But if you are level against cancer, you're not going to get that treated the best way possible, because the overwhelming odds are people aren't going to know that. I met folks who are making, avatars that help you think very differently about how you can follow patients along. You're never going to know what's out there. How do we use our tools to make sure, by touching you every day, that when you do have those crises, you know where to go, where you can find trusted advice that you can use?
I have the great pleasure that I can ask these guys these questions all the time, and so, but if I was just looking for the concise, elevator pitch for the engaged patient, the one piece of advice that you would give to the world, what would it be?
You're asking me?
Yes. You're the neurosurgeon.
I knew that was going to come back and bite me. By the way, I think you said earlier, where you are right now is not where you're going to be, that's where you're going to be. Is that what you said?
We don't really want to study where we are now. We want to figure out where we're going to be and meet people there.
That's what okay. I just want to make sure I understood that.
There'll be a quiz later.
That's right. Look, it's tough to make that concise, the engaged patient. I think, some of it comes back down to semantics again. I think, that there is a didactic sort of relationship between provider and patient. And I think that in and of itself makes it difficult. It makes it difficult for two reasons. One is that it sort of puts the patient in the role of needing care in some way, and it makes them also relinquish responsibility to some extent. So when you're engaged, that means you're not relinquishing, you're taking on responsibility yourself. And it goes back a little bit, I think, to what I said at the beginning. I think the engaged patient is someone who's doing this because it makes them feel good.
Right.
Yeah.
I mean, they feel good.
It's almost as patient the wrong word.
Patient may be the wrong word.
Right.
Yeah, I mean, I think it's really, how do you be engaged human? And we are going to have to disintermediate the doctor and healthcare system from the creation of health because, as I said, chronic disease is not a medical problem. It's a lifestyle problem predominantly, and it's a problem of our environment and the food. As Bill Clinton says, the economy's stupid, it's the food stupid. It's what's driving most of the chronic disease in this country. And doctors learn nothing about food in medical school, yet most chronic disease can be influenced or even cured by food. So we have to, as I said, decentralize care and engage. The engaged patient is really the engaged human who cares about their own life in a way that's connected to others. So I think the connectivity with others who are in their social circles, whether it's online or offline, and understanding that they have self-care solutions that actually work to create health and not just be better compliant to their medication is really where we need to go.
That's great. I think.
If I can just give you
please.
just one word.
Yeah.
It's 2 words. Good life. It's fundamentally about celebrating wherever you happen to be in life. Sometimes you're better off enjoying yourself at a birthday party with the cake or a kielbasa, which is generally an annuity for a heart surgeon. But you're better off with that than the sour dour message that people so often expect.
Yeah.
Right.
So if you're really out to celebrate what is your good life, what you really want to do in life, and we can help you get there, then you'll be engaged.
That's great. Do we have time for a question or two? So I think we have time for a few questions. Gentleman in the front.
I've been involved in discussions about what is health. I came to realize there are studies that shows increased higher levels of 40 hertz gamma waves in brain equates to higher level of consciousness and mental well-being. When do we draw the line? Are these people are best in their physical health? Is there any correlatory studies on mental health and physical well-being?
The connection between mental health and physical well-being?
Yeah, you mentioned the best patient is the one who is most satisfied in life.
Yeah, there's plenty of studies on the connection between, the mind and the body connection, and to the extent that also translates into superior mental health would translate into superior physical health. It's not as direct a relationship, but yeah, I think the point that I was making, and I think that this is almost something that anyone can reflect on for themselves, is that we all go throughout a day, we go through different cycles in our day in terms of how good we feel, how engaged we feel, how likely we are to give something our all at any given time, and if you can first of all predict when those times are, and then lengthen them, and put some of the things that are going to bring you the best physical health, but also other things, most productivity at work, best relationships with family in those green times, you're going to have you're going to be better at all those things. So it's more, I think, a question of connecting the times of optimal mental health to create optimal physical health. And we know that we can do it. There have been studies, but so many of the studies have been looking at small groups of patients at any given time. To be able to say we can do this across hundreds of thousands of people, sort of simultaneously through voice, through something we all carry around in our pockets, is I think very interesting, and I think perhaps represents where we're headed.
But there's not. I don't think there's always a correlation between consciousness, awareness, mental health, and physical health, because you can have very enlightened beings. Like I got the privilege of going to northern India to work with a guy who's the head of the Bon religion, who's the Dalai Lama's meditation teacher, and he had diabetes because he was eating his traditional sampa, which is barley flour every morning. I was saying that flour is not good for your diabetes. And he was able to connect with the right information to lose 35 pounds, reverse his diabetes, and now he's in an even more elevated state of consciousness and health. So I think it's not a direct correlation. It really requires both awareness and then the right information.
Yeah, you gotta know what the right thing to do is. I
Yeah.
think as a starting point.
Sure.
So we come from it was chronic infectious disease and chronic disease. Now we're in lifestyle. And maybe that's even in an era of social health or social disease. We talked a lot about care, connectivity, community. We're still talking about the patient as an individual. I would like to hear your comments on the community, about the social health aspect, and about where we're going to go and really pushing that edge to understand connectivity between people as maybe the next prescription for health.
I think it really comes down to that. I mean, I think, we have to sort of understand that the creation of health is far beyond even an individual's choice. We have to change the community in which we live. And the food environment is probably one of the worst. We created the worst diet in the world and export it to everywhere. 80% of the world's diabetics in the developing world. So unless we really understand how to change that, we're not going to move forward. And that's sort of the elephant in the room. And Michael Bloomberg really struggled in New York to actually make changes. He's now gone to Mexico because they're facing epidemics of diabetes. 1 in 10 children there have type 2 diabetes. So they're eliminating all food marketing to kids. They're taxing soda and junk food. They're eliminating any processed or junk food from all schools and public institutions. They're creating food labeling that makes sense. It's, green, yellow, red. Red's going to kill you. You can't look at a nutrition facts label in this country, even if you're a PhD in nutrition, and know what it really means. So I think we have to sort of begin to look at the sort of social and political changes that need to happen. The problem is they're very tough to change. There's a huge amount of lobby money and industry money that's controlling policy. Even the U.S. dietary guidelines are moving forward slightly, but they're really heavily influenced by industry. And so until we create a shift in our food system, in the way we produce and consume food, we're not going to really change or impact healthcare.
Hey, Mark, what about a different kind of social health? What about digital health? And if you're able to aggregate large communities, ranging from allergies to women's health, how do you start to curate dinner parties there? And what does it take to be a good host to create change?
Well, I think that's the beautiful thing I learned from Rick Warren is he took the purpose-driven life and he got 10 million people around the world to get into small groups to work together to live better lives. And that was sort of what I hijacked to use for purposes of creating a social experiment in health. And he just created a very simple model for creating a host, which is you have to have a heart for people, you have to open your home, serve coffee, and tell a friend. And you don't have to know much, you just put in the curriculum for your small group, and together people get better. And it doesn't require to be a health expert, but you can just be a health champion, or we need literally create millions of community health workers, sort of like Paul Farmer did for TB and AIDS, and that level of social connection and support is what's going to drive the change. And like I just partnered with Zumba. What's a doctor working with Zumba? But they have 200,000 Zumba instructors that reach 15 million people, and they want to create nutrition curriculums to train their Zumba instructors to lead small groups in lifestyle change. And those kinds of sort of disruptive community-based interventions, I think, is where things are going to happen.
Great. Question?
Thank you. Susie Ellis, I was wondering if you could tell us what your definition of wellness is, and if you like the term, and what you think the term will mean in the future.
I'll tackle this. I don't like the word wellness. I think it's like watching paint dry. It sends a very clear connotation that it's a tedious endeavor where even if you don't live long, it'll seem like you did, because life's not much fun. And it is over and over again. I see this happening as people use the word. Again, we all have the same desire, but it's too earnest a phrase. People don't want to live their lives that way. And the people who don't mind the word wellness are usually already living well lives. So they're not the people you're looking for. You're preaching to the choir with that word. You want to use other words, vitality. It's got to be sexy and cool and jazzy and hip, a little edge to it. You put a little testosterone into the message, because although women are the primary receivers of health information, when a woman knows what to do, but she doesn't know how to say it, it's called nagging. And it holds back conversations, important conversations that ought to be having. So if you put a little bit of, think about it for a while, you'll notice it's true. If you put a little bit of the high octane, testosterone into that message, you begin to get change. Speak to the earlier question about community. I think we can use phrases that get at that, The words that I like more are body, because there's a sexuality to it, passion. These are all things that ought to find their way into the phrasing, and at its very core, life. Because when we think of life, we think of much more than the sort of narcissistic desire for our bodies to be able to preserve. It's much bigger than that. It's about ripping life into existence when new life is brought into the world. Offspring and their destiny and what's going on through them. And also reinforces the reality that, at its very core, it's the giving that makes life worth living. And we all know that, but we give lip service to it sometimes. And I'm not talking about just giving all your money away. I'm talking about really just taking the extra moment it takes to say hi to somebody with a smile on your face. Those small things add up in a very big way. And when we use phrases, especially in the healthcare space, we should be pushing in that direction more than just this false promise around what the word well, false in a good and bad way, what the word well means.
Okay, so we got time for 2 more questions.
I thought we went till 2. Panic, they leave.
Ashley?
Yeah, I think it's a quick question for Sanjay. So one of the pieces I want to understand from a brain standpoint is we have a lot of people that perceive, I love this concept of living in the green, and we'll be able to tell, are we living in the green? But a lot of people that, I'm a dietitian, a lot of the people I work with think that, an extra shot of coffee or the 5-hour energy or the sugar is what actually, that's how when they live in the green, that's actually how they're feeling. So will this technology be able to just differentiate between you're living in the green Band-Aid induced as opposed to living in the green authentically?
Yeah, no, it's a great question, and I think it's perhaps one of the most important questions. People have a reaction to all those things you mentioned, a shot of extra caffeine, sugar, whatever it may be. And we all remember that part of it. What we're good at forgetting again, though, is what comes sort of after that, the sort of crash part of it. And if I were to ask you a week from now, tell me about that day that you took the extra shot of whatever, you probably wouldn't be able to delineate that crash part of it as well as the green part you got shortly thereafter. If you use something like this and you start to get a map of your life and you start to be able to equate these various things and really see that, okay, I got that little bit of a boost here, but then predictably, this is going to happen over here at the worst time of the day, at what should be the most productive time of my day, the time of the day where I'm going to go exercise, I'm going to have important meetings, whatever it may be, and I'm starting to crash, and that becomes predictable. That's part of that whole self-awareness. That's part of the whole idea that A, you're going to be self-aware, but B, you can start to get interventions that are surprising. We know you're about to do that extra shot of whatever. You also have a meeting at 2 o'clock that's very important. You are going to be crashing at that time if you do this. I'm sort of making that up a little bit, but I'm saying think about it in that sense more than just the immediate reactions to anything. And that's what I find sort of exciting about it.
And to make this a little bit more tangible for you guys, everybody in their Shakers has an invitation to download the app. This adaptive trial is going to run through 2015. Sanjay is the chief investigator. Georgia Tech's Human Computing Lab is studying the data. It works in every language, so we've enrolled global workforces, nurses, moms, the military, students, and we're going to be looking for key insights that hopefully lead to some really powerful interventions by trying to work with a technology that's frictionless. You don't have to connect yourself, just do what you do, talk and text, and let's see what kind of improvements we can make over time together. But I want to thank this great panelist.
Before you said I could have a rebuttal time.
Okay, please.
So the real story, what happened, this is relevant, and I'll leave Sanjay alone for a moment. Although he's on the show tomorrow, did a great job. Oprah had told me that I should meet Jeff Arnold. She'd been so jazzed up by conversations. You know all those people in your life that you get to talk to them, and if you had a stress app, you'd know you're excited by talking to them because it just gets you going. And so we started talking about this, and I had all these great ideas that I thought they were great about how we get a great social experience, the community issue, to deal with wellness, all this stuff coming together. And he listened very politely, as Jeff tends to do. And at the end of the conversation, he says, "That's all great. You'll never be able to do it." And I said, "Why not?" He said, "Because the reason those things don't work is they're not built on the chassis and a business engine that really can connect people in a meaningful way." So I want to applaud you very much for being a visionary in this area, because I didn't really understand a lot of the things that you were talking about 6, 7 years ago. I get it now pretty crystally clear. And I think all of us in this room have an opportunity to think about it in the same way. build for us, the doctors in the room, businesses that can be solvent so we can put on top of that things we need to do for society. If we do it in that way, we'll build a true experiences that I think we can make that are sustainable. So things like what you've done with Sharecare, but there are other great companies represented here as well. Because it makes a lot of difference to us that we can start to invest ourselves, because we have to put and mind share into ideas that we know will be sustainable. And that's what's held medicine back. The reason we don't have routinely available apps now for hospital discharges, we don't know who to trust. Is it the 8-track stereo, the cassette, DVD? We don't know where to go. Build those platforms for us, as I know you're trying to do, and we'll be there for you.
Well, I think Digital Alliances is a great way to end this panel, and I want to thank each and every one of you guys for teaching me so much and doing so many great things in the world. So thank you.
Great.
Thanks for listening.
Thank you, Don.